Welcome to COVID-19 Moving Ahead, Health and Safety Awareness, a guide to returning to campus. This training is designed to communicate and demonstrate our commitment to protecting the health and safety of Langara students and employees who need to be on campus. Langara has met or exceeded the provincial COVID-19 requirements for resuming educational activities, and this training will convey what you can expect to see and experience upon your return. Please note that this training and requirements from BC's Ministry of Advanced Skills, Education and Training, WorkSafeBC, or the Provincial Health Officer may change over time, and that you might be required to refresh your training in the future. Please be sure to visit langara.ca/COVID for our latest updates. Coronaviruses are a large family of viruses that can cause illnesses that range from mild, like the common cold, to life-threatening respiratory illnesses. COVID-19 is a new coronavirus that has had a global impact. COVID-19 can cause a variety of symptoms like a fever, the chills, a new worsening or barking cough, or a shortness of breath. This list does not include all possible symptoms. Visit the BC Centre for Disease Control website for an updated list as we learn more about COVID-19. COVID-19 is most commonly spread from an infected person through respiratory droplets generated when they cough or sneeze. In addition, it can also be spread through close contact with others, such as talking, touching, or shaking hands, or touching something with the virus on it, then touching your mouth, nose, or eyes before washing your hands. For these reasons, physical distancing is the best way to protect yourself from exposure to the virus. If you are ill or have come into contact with someone who is a confirmed case, do not come to campus. Complete the self-assessment on the bc.thrive.health website or call 811 or your healthcare provider to determine next actions. Please communicate your situation to your manager, program leader, or instructor so they're aware of any supports. If you have a severe respiratory illness or a medical emergency, call 911 immediately. If you're unsure, visit the BC Centre for Disease Control COVID information at the link below. If you become ill while on campus, you will be directed to an isolation room where a first aid attendant will provide further care and direction. The hierarchy of controls is a system used in the health and safety industry to eliminate hazards and minimize risk to ensure you remain safe. When applied to the risks associated with COVID-19, the hierarchy helps workplaces choose from the best options available to minimize the risk of spread. The selection of safety measures for reducing the risk of exposure and spread of COVID-19 will be based on this hierarchy of controls. Here's how it will be used. Eliminating the hazard completely is always the first choice and most effective. For COVID-19, this could mean working remotely, teaching and learning online, and practicing physical distancing. Substitution involves replacing the material or process with a less hazardous one. This could involve working with a mannequin instead of a human subject where feasible. Engineering controls are physical changes to the workplace that could include adjusting HVAC controls to increase air exchanges in small rooms and in healthcare settings. It may also be the installation of barriers in classrooms and service areas to prevent droplet spread. Administrative controls involve identifying and implementing safe procedures. This could mean alternating weeks of delivery in academic labs to reduce the number of persons in a room at one time. It could also mean extending the hours of operation. Personal protective equipment, or PPE for short, is the least effective control. PPE, such as gloves and masks, are often not a good protective measurement and are most often used in combination with other items in the hierarchy. This may mean wearing a mask when you are not able to control physical distancing, like practicing a patient lifting technique or working under a vehicle. COVID-19 Precautions and Preventions. Physical distancing is one of the most effective ways of eliminating the risk of spreading COVID-19. The best way to protect yourself when you are on campus is to keep 6 feet or 2 meters away from other people. To support this, there will be several reminders to help you judge the 6 feet physical distance. Occupancy levels have been established for common areas and classrooms, and visual cues will help you identify available seating in common areas and classrooms. Adhere to maximum occupancy signs and visual cues posted to remind you to stay 6 feet from each other. Encourage others to stay home if feeling unwell. Discourage any unnecessary on-site contact, such as handshakes. Support physical distancing by holding conference calls, meet virtually, or send photos or video instead of having on-site visits. Be mindful to maintain 6 feet distance from each other at all times. Be aware of the amount of available space, furniture arrangement, and the number of people in the area. Work in different areas to avoid physical contact. Although staff and students may have some presence on college property, where possible, services will be offered virtually, and everyone will be asked to work, teach, and learn remotely as much as possible. We encourage everyone to communicate by phone, email, or video conference rather than face-to-face. This will reduce the on-site population, which prevents overcrowding and makes it easier to maintain physical distancing on our campuses. Only the essential delivery of approved in-person student programming is permitted on-site under government emergency orders. Some staff and students may struggle with working or learning remotely, or with being on campus. A list of mental health resources can be found on the college website. Employees can refer to my Langara or Langara's teaching and development team for effective strategies on working and teaching remotely. Students can access remote learning tips and other FAQs via langara.ca/COVID. It's important to try and limit your interaction with others and your time on campus whenever possible. This will reduce the opportunity for spreading the virus and aid with people accessing spaces for cleaning and disinfecting. While this may be difficult as we want to socialize and engage with each other on campus, it's important during this time that we don't gather where physical distancing can't be maintained. Minimize travel throughout the college to only those key areas that must be visited, and only access those predetermined areas. Please refrain from using your mobile device while walking through the college, as it often becomes a distraction and could prevent you from maintaining 2 meter or 6 feet distance from others. For Langara's moving ahead health and safety plans, some areas may be closed. Please do not enter unless it's an emergency. You can help prevent infection and spread by using good hygiene practices. One of the best ways to prevent the spread of COVID-19 is to wash your hands properly with soap and water. Wash your hands after using the bathroom, after coughing, sneezing, or blowing your nose, after contact with someone who is sick, before eating and preparing food, before touching your mouth, eyes, nose, or open cuts, and any time they look dirty. The following video will demonstrate the proper way to wash your hands. Another common courtesy to yourself and others is to cover your coughs and sneezes with a tissue, which you should then immediately throw away. If you can't get to a tissue quickly, sneeze or cough into your elbow, since you don't typically touch surfaces with that part of your body. In addition, disinfecting sprays and paper towels or wipes will be made available in classrooms, labs, and other common areas to enable you to wipe down common touch surfaces like computers and tabletops before and after their use. Langara has installed hand sanitizer stations in key areas such as hallways, corridors, classrooms, academic labs, and customer service centers. Wash your hands regularly, and when washing facilities are not immediately available, use hand sanitizer. If supplies are required, email facilities@langara.ca. Where the previous measures are not possible, personal protective equipment, or PPE for short, may be necessary to reduce the potential for exposure to COVID-19. The most commonly used protection are gloves and face masks. Wearing gloves is not a suitable substitution to practicing good hand hygiene. Gloves are meant to prevent transmission from one area to another. If worn at your workstation or in a classroom, the virus can still easily spread to common touch points like desks, phones, and door handles. Instead, you should wash your hands frequently, use wipes or disinfecting spray and hand sanitizer. Medical face masks, such as N95 masks, should be reserved for healthcare providers and will only be used where they are normally issued due to academic program or work requirements. For example, healthcare programs or dusty environments. Wearing non-medical face masks may be an added way to protect others around you, particularly where physical distancing may be challenging. They're intended to protect others from your infectious droplets and prevent other people's droplets from landing in your mouth or nose. Non-medical face masks do not provide complete protection against viral particles because they do not provide a perfect seal on our face. They are not tested to recognize standards, and their effectiveness will also vary. Therefore, they do not exempt you from following physical distancing rules. Everyone is encouraged to keep a cloth mask on hand when they're on campus for those situations when physical distancing may be compromised. However, as of August 18, 2020, it was not a requirement of BC's Provincial Health Officer. If the Provincial Health Officer's guidelines change, the college will adjust our policy to follow. Click here to learn how to properly wear, fit, remove, and clean your non-medical face mask. Depending on the time of year, there may be limited entry points to buildings on campus in order to monitor college community members and ensure we don't exceed our available capacities. It's critical for the safety of the college community that anyone who is feeling ill not attend the college. In order to support this, before going to any of our college campuses, you'll be asked to participate in a screening process. Students should limit their time on campus by arriving just before their class and departing immediately after. Faculty and staff should only be on campus for the amount of time required to facilitate student or essential activities. Remaining on campus with no scheduled activities is highly discouraged. Safety is always everyone's responsibility. COVID-19 has changed the way we need to behave when we're together. It takes practice and sometimes reminders from others to make sure we follow the protective measures. It's important to speak up in a respectful way when someone forgets. When a college community member refuses to comply with protective measures, security guards and special safety advisors can assist. Call security at any time. The Student Code of Conduct and employee disciplinary policies also include repercussions for health and safety violations. You may be asked to leave campus if COVID protective measures are not followed. Visitors should be discouraged from coming to our campuses. All contractors and visitors require approval and must register at campus security. Contractors are required to submit their COVID-19 operational plan to the college for review prior to being allowed on campus. When waiting in lines is unavoidable, there will be stickers on the floor advising of the safe distances that must be maintained between others. Please be respectful of others and their physical distance. In order to provide a safe environment, washrooms will have posted occupancy limits. Please respect the occupancy limits and observe appropriate distance if others are in a washroom with multiple stalls. As an added infection control measure, some washrooms will have an arm pole installed to allow for the door to be opened without the use of hands. Paper towels will be available. On the advice of your local health unit, air dryers will remain connected as they don't pose a significant risk of spreading infection. All classrooms and academic labs have been reviewed and assessed for maximum occupancy levels. In order to ensure proper distancing in classrooms and academic labs, you may observe the following: movement of desks and workstations to maintain appropriate physical distancing from each other, Do not move desks. Barriers installed where physical distancing is difficult to achieve. Stickers or signage on chairs or desks advising which are acceptable to sit at and which are not. Possible schedule alterations to reduce class sizes into more manageable groupings where physical distancing is not a factor. Where classrooms have two doors, one will be identified as an entry while the other will serve as an exit. Please mind posted room layouts and COVID reminders. College programs which are being conducted online may require students to retrieve equipment, instruments, or tools from one of our campuses. Because access to the college is limited, curbside pickups may be required to collect critical program equipment. Elevators remain accessible, but physical distancing principles must be applied. Signage is located inside and outside of each elevator and on each floor. The capacity of each elevator will vary based on the elevator car size. Where physical barriers are not installed in the cab of a vehicle, only one passenger per vehicle is permitted at this time. This includes college-owned vehicles, use of personal vehicles for college business, or car and truck rentals. Strict cleaning protocols are in place for any shared tools or materials in the vehicle. If you are ill, or in an unfortunate event where a college community member becomes ill, is confirmed to have contracted COVID-19, or has been in contact with a person who is a confirmed case, it's critical that it be reported to the college as soon as it's known. Early self-isolation is key to reducing transmission through our community. Contact tracing is performed by public health authorities when a suspected or confirmed COVID-19 case is reported. In order to identify others that may be at risk of transmission, public health will want to know your movements throughout the college. Please respect the confidentiality of suspected cases. Public health will inform the public and college community as required. Methods to better track your movements or activities while in the college include keeping your Outlook calendar up to date with locations visited on campus, or using your class schedules to help you remember your movements on campus.